Now, to kick off the event, we have a very special session that we are starting for the days. From DHN Forum Bangalore to DHN Forum Mumbai, DHN's impact on catalyzing India's digital health system in our nation. Our speaker is the visionary behind this movement, our very own Mr. Vishnu Saxena, founder and CEO of Digital Health News and Scale HealthTech. His insights will set the tone for the impactful discussions ahead. Please welcome Mr. Saxena on the stage.
Good morning, everyone, and hello, Mumbai. Welcome to the DHN Forum. And I would say, welcome to the first DHN Forum Mumbai. It's the first DHN Forum Mumbai, not the first DHN Forum. So I'm very honored to be here with all of you. And thank you so much for taking time. I know it's a Friday, and it's a busy, Mumbai is so busy. And taking time for the full day event, it really means a lot. So thank you so much for being here with us today. And especially to our esteemed attendees, delegates, speakers, guests. So really thanks to all of you for coming here. My name is Vishnu Saxena. I'm a founder and CEO of Digital Health News and Scale HealthTech, a boutique health IT consulting firm based out of Atlanta, Georgia. I'm really very honored, to essentially present to you the DHN Forum Mumbai. And importantly, before I start talking about DHN's impact on catalyzing India's digital health transformation, what we are up to, what we are doing, and why we started, what it means to you, what it means to India's digital healthcare transformation journey, and the path that we are on. I wanted to acknowledge two of our esteemed guests who have came all the way from the US to be part of this journey, this movement. And I would like to recognize and honor Mr. Fabi Abraham, Executive Vice President and Chief Strategy and Innovation Officer at Memorial Hermann Health System in Houston, Texas. Fabi, thank you so much for coming. If you can please stand up. And Mr. Neil Gomes, Chief Digital Officer at Emory Health Caritas, a prestigious health plan based out of Philadelphia, and former head of DICE, Digital Innovation and Consumer Experience at Jefferson Health. Neil, thank you so much for coming. Appreciate it. And Fabi has been a consistent force with us. He has been there with us at inaugurating DHN Forum Bangalore. So Fabi, appreciate your trust and confidence in DHN Forum. With that, I want to touch upon, if I may, just give me a second, please. Before I start talking about the impact that we are trying to bring on India's digital health landscape, I want to touch upon real quick in terms of the idea of digital health news, who we are, what we are doing. As I understand, many of you in this room, are experiencing first time what the digital health news is, right? So the idea of digital health news is not creating another news platform and presenting you the news. That is something that we all, in some form or other, are consuming it through a variety of sources, whether it is social, whether it is some other platform. So, that is not the objective. So the idea of digital health news is we are India's the trusted source and India's first dedicated digital health news platform for all health tech news, policies, updates, and in terms of, what is happening in the world of digital health in India as well as overseas. Now, we don't limit ourselves as just, the news. We are crafting the future of healthcare narrative. That is very important. If you see, the news space is too crowded, right? It's too busy. And digital health news is not just another player in that world. We are the catalyst set to transform the way healthcare news is consumed, understood, and leveraged. So we are crafting the future of healthcare narrative through digital health news. Curated insight, not just the reports. We are living in the age of abundance of information, right? So drowning in the information, sea of information is very easy. And making the meaningful sense out of that data is very challenging. So I'm very proud of our team that we have, industry analysts, and the whole team that we have. So we filter the noise, and we present you the actionable insight that empower you every day. So when you go to digitalhealthnews.com, when you see the insights, when you see the reports, and when you see the articles, when you see the podcast and all, it empowers you on that day. It empowers your understanding in terms of what's happening, right? That you can use in your day-to-day function, you can apply that back to your enterprise. So that is our goal. From local to global, last year when I came in after 12 years, and I landed to Mumbai, and I saw a banner in Mumbai's T2 airport, India at heart and global in the spirit. I really love that phrase. I was sitting in a coffee shop, there was some banner hanging in that terminal, India at heart with the global in the spirit. And DHN was not born, by the way. It was, I came here to participate in a THIT conference, thanks to Dr. Ganapati. He invited me to be as one of the speakers. I was talking about data democratization, accelerating India's digital health transformation. I was sitting in the Mumbai airport, and I really liked that term. And when we started DHN, and one of our goal was, the healthcare is a local issue. Healthcare is very centered around what matters to us most in that regional setting. But then we wanted to have a cross-pollination. What does that mean? We wanted to have focus on India's healthcare challenges, but at the same time learning from across the world. What's happening? So it is always good to adopt the best things from wherever you can. So we are local in spirit, but global in heart when it comes to digital health news. Collaboration and open dialogue. One of my dear friends, Neil and Fabi, you know him very well, he often says, the future of healthcare will be built on shoulders of meaningful partnership. And if Fabi and Neil, you can guess who that person is, I know you will guess it right. So we are fortunate to have partners like Chime India, managing Dell and all, and we just started the journey a couple of months back. So we are very much open in terms of collaborating with the like-minded, and even the people who have the ideas that can shape the trajectory of India's digital health transformation. So joint forces. So we are all about understanding and welcoming the ideas and collaborating with the industry partners, because DHN cannot solve all the problems, so we need ecosystem partners so we can go together across the ecosystem coverage. One of the goal and one of the unique aspect of digital health news is that we focus across the ecosystem, across the value chain, whether it is hospital, whether it's digital health startups, whether it is VC and investment community, whether it's government organization like NHA and state and the federal government, or pharmaceuticals. So we focus across the value chain within the healthcare, larger health tech, and within the digital health tech space. And also on the function side, if you talk about whether it is EMR, EHR, of course the adoption of EMR, EHR is a key thing in order to have the equitable the healthcare and the data flow across the nation. So whether it's the EHR, EMR, telemedicine, emerging technologies, AI, automation, and all, patient engagement, patient experience, population health. So we focus around all those areas that matters, right? Traditional topics as well as the emerging topics. So we not only focus across the value chain, but also across the the trends that matters to India's digital health ecosystem. So that is digital health news. Now, as I said, our aim was not just limited to create a beautiful platform and be the leader there. Go beyond that. So the idea of DHN Forum was born because we wanted to empower the regional ecosystem. If you think for a second, India is doing pretty well when it comes to digital payment. 7-8 years back, it was a dream. Now you can see a street vendor having a QR code. That impact, that empowerment, empowers that person's livelihood on that day, right? He gets the money in his pocket, in his bank account. That is the change, that is the empowerment that we have brought as in the nation, right? So the idea is that, and that is across India. Now, I thought about it, and I realized that if we want to embrace the across transformation of healthcare or digital in India, It has to be, the technologies, digital health technologies have to be adopted across the nation. Now, in order for that to happen, the regional ecosystem, the regional clusters, like Delhi, Mumbai, the tier 1 clusters as well as tier 2 clusters, they have to be empowered, right? And when we bring the innovators, transformers, we club them with the hospitals, with the pharmas, with the VCs, we are moving the needle towards the goal, towards the objective that we want to achieve. So DHN Forum is an ideal platform that aims to empower the regional ecosystem, whether it's Bangalore, whether it is Delhi or Mumbai, Ahmedabad, Lucknow, Jaipur, or whatnot. So DHN Forum is a regional powerhouse, aims to empower the regional ecosystem. CIO, CXO podcast, we are doing lots of CIO and the CXO podcast. There are so much of talent, there's so much of innovation going on in this country. Variety of hospitals are doing lots of things. We want those CIOs and the CXOs and the ecosystem partners, the industry partners to come together and talk about how they are doing that transformation. Newsletters, we are very proud that we are moving forward. Within the short span of time we started, we are touching 4-digit numbers in terms of the newsletter that we are sending every day and on weekly basis. Research and survey, this is something very important. DHN, the aim of DHN is that you would like to trust the reports, the insight that we are bringing. And, I'm fortunate to have Chime India as our partner. In DHN Forum Bengaluru, we talked about India's digital health trends and outlook for 2024. DHN Forum Bengaluru happened on 31st January. It was just the start of the year. And we wanted to capture the pulse of the nation when it comes to digital health, adoption, where the CIOs, the CXOs, the hospital CEOs are thinking when it comes to digital health. So we partnered with Chime, we did the survey, and the reports came out to be such a fantastic, insightful report. And I would encourage you to go to digitalhealthnews.com and look for our previous report. That will give you highly insightful, actionable insight in terms of where India is heading, where India was in 23, where India is heading in 24 when it comes to digital health trends and outlook. Now, today, we are going to reveal a similar trend on the cybersecurity. We have partnered again with Chime. Our sample size has really gone big. And I will talk more about me and Mr. Gilesh Kulkarni in second half. So we are doing research and survey, highly targeted, highly insightful, highly data-driven, that you would love to read and apply back to your organization. White papers, we are doing lots of white papers in terms of, whether it is a trend, whether it is a technology, whether it is a success story. So there are lots of ways where DHN is helping out, not only the hospital, but as well as the industry ecosystem partners. So that's the idea of digital health news. We are more than just news, and it is all about the insights that matter. It's not about the news, it's about the insights that matters. All right. Now I want to talk about real quick. I know I have the clock is ticking. So I want to touch upon real quick in terms of idea of DHN Forum. You heard a little bit in my previous slide. So shaping the present and the future of healthcare in India. The whole philosophy of DHN Forum right now sitting in this room is to bring together all the stakeholders under one roof, identifying the innovators and transformers, disruptors, identifying the top CXOs from the industry, going to the regional cities, tier 1 cities and tier 2 cities, because I'm a big fan of empowering the country from within inside. You can't just be on the edges of the country. Kolkata, Mumbai, Chennai, Delhi, and all those things. We have to go to the inner cities. We have to empower there. And when we empower the heart and the soul of the country on digital health, that's where the whole transformation happens. So the idea is that we are empowering the regional digital health ecosystem. Top digital health CXOs from India and the US. You have seen Mr. Fabi and Mr. Neil Gomes, their trust and confidence in DHN Forum. And the idea was not to just bring Fabi and Neil for DHN Forum, Bengaluru or Mumbai. The idea is cross-pollination. I want our Indian colleagues to understand what they are doing, how they are leveraging the digital health transformation, and how they are impacting their institution, Memorial Hermann and Emory Health and all. And likewise, Fabi and Neil can learn from our Indian colleagues in terms of how India is doing the digital health transformation, and they can apply back to the US in their own organization. So it's cross-pollination. Defining themes of discussion that matters. This is something very important. We are setting the trends. In Bangalore, we talked about consumerization of health. We talked about unlocking the value of the data. We talked about the digital divide that happens within the C-suites. Here, Mumbai, we are talking about innovation, investment, and transformation. So these are very important themes that matters to healthcare industry as a whole. Collaboration and open dialogues, as I talked about, it is very important. DHN Forum cannot happen in isolation. Industry partners, very proud to have a Dell, very proud to have Manage Engine, Chime India. And the idea is we are very niche. Idea is we don't want to have a crowd. We are not a traditional event management company. I run a successful health IT consulting firm. I've been into US healthcare, worked across health system, health plans, pharmaceutical, solved variety of problems. I've been a consultant. I led healthcare practices in the companies like DXC, Capgemini, and others. I worked together with Neil. Neil is my previous customer as well in my previous life. And so the idea is that we are at the forefront of our customers' health, solving healthcare, our customers' healthcare problem. So we are not a traditional event management company. So we are the digital health leaders who came together to help India in terms of transforming on a digital health journey. And of course, showcasing technologies and solutions. It is very important that we showcase, we demonstrate, we identify, we vet, and we bring those technologies that matters. Not shiny objects, but real practical solution that matters. So that's the idea of DHN Forum, and I'm very proud to basically present to you the second DHN Forum and the first DHN Forum in Mumbai. This was the journey we just started. Now comes to the impact. The biggest impact I was thinking, we just started the journey. We had DHN Forum Bangalore. Now we are doing DHN Forum Mumbai. The impact, one of the biggest impact that I realized is that we started the conversation. We started the conversation because, it is very difficult to really understand and appreciate the power of digital technologies in solving healthcare challenges, right? Bringing together the stakeholders under one roof and then clubbing them with the innovators and transformers, it really matters. There are, on the one side, innovators and the transformers and the disruptors are thinking about solving healthcare's problem. On the other side are the executives who actually, would like to experiment, would like to embrace those technologies, but nothing is happening. So we are trying to bring that awareness and understanding of digital health technologies. That is one. B, and of course, advancing the conversation around the healthcare challenges. The challenges, like we are the most populous country on the planet Earth, brick and mortar, even the government is not the answer for every solution. We have to come together as a private-public partnership and the VCs and innovators. So we have to come together as a country as a whole in order to move the needle. And NHA is doing a fantastic job in driving that conversation on unlocking the value of the data there. So the idea is that we want to advance the conversation on the topic that matters to the hospital executive in Chennai, in Bangalore, in Mumbai. The challenges that hospital executive will face in Mumbai or Chennai may not be drastically different the challenge that people in Delhi will face. But the context has to be there, right? Bringing together the key stakeholders from across the value chain under one roof, as I just mentioned. Identifying and bringing innovative digital technology, solving real healthcare challenges. That's something is very important. And I will talk more about it, what we are coming up to. Empowering local innovators and transformers, battery included. What does that mean? Battery included means that it is not just we are bringing them and we are presenting them. We are actually empowering them, from within. So it's not passive, it's active. So if they are innovators, solid technologies, they have done something, implementation and all, and their technologies is being used, excellent. We would like to help them how we can accelerate their journey. Empowering clinician and empowering patient. ultimate goal is, the future of healthcare is consumer-centric. The ultimate goal is to help that patient, to help empower clinicians, nurses, staff. So that's the ultimate goal. Whatever we are doing, whatever we are talking in this room, aims to help patients, aims to help physicians. Now, I'm really super duper excited to talk to you about what is coming next from DHN, from Digital Health News. So folks, we are launching DHN HealthTech Innovation Challenge. This is something, very dear to me. And the idea is to attract high potential market ready digital health startups across certain categories. And they will go through the pitch competition, and then we will choose the right startups, and we will have the demo day. And I'm very proud in this journey, we have NIMHANS. I would give a big shout out to Mr. Girish Kulkarni and Dr. Girish from NIMHANS in joining this journey, and also Triple ITB. If Ms. Lakshmi Jagannathan is in the audience, I would like to acknowledge Ms. Lakshmi, your support, and be part of this journey for DHN HealthTech Innovation Challenge. So stay tuned. Please go to dhninnovation.com a week from now, not right now, a week from now. So the application will be open and everything will be there. So please mark it down, dhninnovation.com. Please check it within a week and you will get all the insights there. DHN Plus. DHN Plus, something I can talk about. This is our subscription-driven service that we are launching. So exclusive benefits, exclusive article access, ad-free experience, unlimited bookmarks, download articles in the PDF format, exclusive webinar access. So we are bringing the premium content that you deserve. That's the philosophy. So DHN Plus would be available to you. You can go and you can sign up and start empowering yourself. Now, Innovation Challenge, as I just mentioned, just give me a second. One second, let me go. Anyway, I talked about Innovation Challenge in detail. Please look out for dhninnovation.com. And last but not the least, get ready, India, to experience a health tech event like never before. I'm super duper excited to present to you the DHN Conclave, a 2-day, super exciting event that is going to talk about a variety of themes that you can imagine that matters to our healthcare stakeholders, that matters to our innovators and transformers, that matters to the government, that matters to the state and federal government executives and all. So DHN Conclave, DHN Conclave we are launching in third quarter of this year. Dates are yet to be decided. It would be potentially in mid of November. So please look out for more updates at digitalhealthnews.com about DHN Conclave. So that is going to be a transformative event in history of India in terms of, like the way health tech event happens. And I would be super duper excited to host all of you there with a greater audience from India, from the US, from across the world. And the whole aim is to, again, come together and discuss together and solve the problem of the healthcare and accelerate India's digital healthcare transformation. So with that, I think I would like to thank you once again for joining DHN Forum. I look forward to engaging the rest of the day with all of you and answering any of your questions. So thank you once again. Over to you, Varsha.
Thank you, Mr. Saxena, for providing us the wonderful presentation, which actually told us how DHN was born and what was the journey of DHN Forum Bangalore to DHN Forum Mumbai. Because digital health is not just about technology, right? It's about empowering individuals, be it physicians, patient, any which. It's the journey. It's DHN journey was not just to providing insights. It's not just about the news. It's about to empowering the regional ecosystem of digital health. So thank you so much, Mr. Saxena, for your opening remarks.